Supinator. Supinator is not powerful. It's not powerful. Okay, when you have a casual movement, you say, "Hey, how are you doing? You know, you look great." Okay, so this is a casual supination. Okay, but if you're gonna do a screwdriver, this muscle gonna work. So your what? Biceps coming. Okay, the biceps coming. Now that's your right-handed. I'm wondering if you're left-handed, what are you gonna do? Left-handed, what are you gonna do? Well, your pronator's coming, right? Your pronator have to do it. So that's why you need to ask the patient, are you left-handed or right-handed? All right, especially the handyman. They have some kind of injury. You want to see what's going on. Yeah, so find out. So supinator, proximal attachment to the lateral epicondyle of the humerus. Again, radial collateral ligament, annular ligament around, okay, then the head of the radius there, and the supinator fossa and the crest of the ulnar. Mouthful, okay. Or they need a lot of more attachment to be able to grip that. Distal attachment is the lateral, posterior, and anterior surface of the proximal third of the radius, basically cover everything there, so they're able to hold it back, okay, to supination. So main action, the name tells you, supinates forearm and rotate the radius to turn the palm anteriorly, okay. But remember, this is not powerful, this is casual sense too, okay. If you do it forcefully, you need a lot of resistance in your biceps. That's the one. Ooh, look at that. I need to work on that. Innervation, deep branches of the radial nerve, C5, C6, all right? Artery supplies recurrent interosseous artery, which is deep.